Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is poisoning by medicines. In general terms, we can even state that all medicines are poisons in a true sense. Now, why can we state like that? It's just because of the fact that a right dose and a right person has to be chosen for any medicine. So if it is not a right person and it is not in a right dose, all medicines can prove to be poisons. Now in this lecture, we'll be discussing in the first section the autopsy investigations and analgesics. So even the milder form of analgesics that are the painkillers, they can prove to be toxic in a lot of people. Now the results of the laboratory tests whenever we are carrying out an autopsy investigations in which poisoning was due to the medications prescribed by any general physician, all these laboratory investigations are of a critical value over here. So we'll be discussing these results for the laboratory tests over here. Moving on, we'll be discussing aspirin and the other salicylates. So aspirin, apart from being used as an analgesic, it is an anti-inflammatory as well as an antipyretic drug. So even it can prove to be toxic. So what are the toxic signs and symptoms relating to the aspirin intoxication? We'll be discussing all of these in this first section. Moving on, the paracetamol poisoning. It is again very significant, and we'll be discussing that in this first section as well. In the second section, we'll be discussing the anxiolytics and the antidepressants in details. Now, if we have a closer look at these antidepressants, these benzodiazepines are clinically very important, and they're usually prescribed to the manic depressive episodes in any person. For example, even in the bipolar disorders, they are prescribed very commonly, but still they have a lot of toxicity observed. So the phenothiazines and barbiturates and another antidepressants, or even they can be placed in the group of the anxiolytics, that is the treatment of the anxiety. So even they can cause toxicity in a lot of patients. And so that is discussed in detail in this second section. Then we'll be dealing with the insulin poisoning. So even insulin, that is an anti-diabetic drug, it can be proven toxic in a lot of cases. Even the untrained internees can administer insulin in the toxic dosages, and that can prove to be fatal for a lot of individuals. So we'll be discussing that, for example, the signs and symptoms, the managements, and the autopsy findings. As a forensic practitioner, it is very important to discuss the autopsy findings. We'll be discussing in the third section the opioid drugs in detail. So the opioids are again very important. Even they can be discussed under the drugs of abuse because they have their dependency. It can be psychological and it can be a physiological kind of a dependency, and that is discussed in detail in this third section. Then we'll be discussing the autopsy appearances specific to this opioid drug poisoning and the toxicological analysis. What are the kind of specimens that has to be sent to the chemical pathologist for further details? And even the samplings of the tissues, for example, the liver, because that is the organ of the metabolism. So even that is discussed over here, what samples have to be sent to the histopathologist. Moving on, we'll be discussing the hallucinogens, methadone, that is even used for the treatment of the heroin addiction, but still it has its own toxic levels and it can cause deaths in a lot of people. So we'll be discussing phencyclidine also in this opioid drug section, and its toxicity and its dependency and the autopsy appearances all are discussed over here. In the fourth and the final section, we'll be discussing amphetamine and cocaine. So cocaine, which is also known as crack in a lay term, and the lysergic acid diethylamides, even some of the designer drugs are available in the drug dependence corner. So all of this is discussed over here in this fourth section. The modern drug dependencies are discussed over here. So the amphetamines and the cannabis have their specific toxicities. What are the signs and symptoms over here? And what are the autopsy findings in deaths related to amphetamines, cannabis, and cocaine is discussed in detail over here in this fourth section. I hope you want to learn more about this poisoning by medicines. So do watch the other sections of this lecture as well.